Hello everybody, my name is Gary Van Wettering and I'm the Director of Facilities here at Lakes Regional Healthcare, and today I want to talk to you about a negative pressure isolation room. Behind me is the one negative pressure isolation room that we have here at the hospital, and we are looking to raise funds right now to add an additional one. So we want to walk you through the key components and give you a little education. The first thing that you will notice is what we call an ante room. So here we are in the ante room of our negative pressure room, and the purpose of this ante room is to provide an intermediate space between the patient room and the corridor. And basically it provides a space for the medical staff to store certain items, to put on and take off their PPE, and to wash up prior to exiting the patient care room. So now we are actually in the negative pressure patient room. We've exited the ante room and we're now actually in the room. And basically the reason why hospitals have negative pressure isolation rooms is to prevent infectious germs or particles that are in the air inside of this room from getting into the HVAC system and spreading out through the rest of the patient area, or getting literally through the doorways and getting out into the corridors. Okay, so the inside of this room really doesn't look anything different than any of the other inpatient rooms that we have once you're inside. But there are several key components that you don't see that are key to the operation of this room. One would be valves that are above the ceiling in this room that very accurately control the amount of air coming into this room, HEPA filtered air, and the amount of air exhausting out of this room to the outside through HEPA filters. So the way this room works is supply air is brought in at a very controlled rate, and air is exhausted to the outside at a higher rate, causing the pressure in this room to go negative. So it's actually trying to pull air in out of the hallway. Another critical component of any pressurized room, whether it's negative or positive, is a room pressure monitoring system. And basically that is a digital device. It's located inside of the ante room, and it is comparing the pressure inside of the room to the pressure in the corridor. And it's a good visual for the medical staff as they enter the room to make sure that it's negative. And it's also something that maintenance and facilities staff will monitor and record on a daily basis. So in order for Lakes Regional Healthcare to add another negative pressure isolation room in our efforts to deal with additional COVID patients, it would end up being a construction project. The biggest thing from a physical perspective is we would need to add an ante room, because most of our inpatient rooms do not have an ante room. So that would take some physical general construction. In addition, we would need to do some HVAC work to put in these precision controls for controlling the airflow in the room and exhausting it outside. All of that would need to be tied into our building automation system, so it's controlled and we can monitor it and tweak it as needed. There would need to be electrical trades, sheet metal trades, finish trades. So it would end up being a miniature full construction project.
Hello, my name is Sonia Ham with Lakes Regional Healthcare, and we hope that this video really helped you understand better what the Patient Protection Fund is all about and what that isolation room is. To date, we are about halfway there, so just over $23,000. Thank you so much to those of you that have jumped on board with this project. But I wanted to let you know we're still working on it, and so we would appreciate your contribution still towards the Patient Protection Fund. Remember, this is an isolation room that helps protect from things like COVID, but other respiratory illnesses that might also be contagious. So it keeps those things in the patient room and doesn't contaminate the hallway or other patient rooms in the facility. One other fun way to get involved is the Roses Just Because program, and you may have seen a little bit of information on that already. It is available on our website, so I just wanted to entice you a little bit to go to that website, lakeshealth.org. We've got information on the Roses Just Because program that will benefit the Patient Protection Fund. But again, would appreciate your contributions in whatever form that is. You can email me at sonia.ham@lakeshealth.org, or you can call me at 712-336-8791. Or again, our website is www.lakeshealth.org, and we have lots of information on there about the programs. Plus, we make it really easy for you to donate online as well. So again, we appreciate your assistance with the Patient Protection Fund. And again, if you have any questions, give me a call. Thank you and have a great week.